Hello there and welcome to Nursing with God's Favor. In today's class, we'll be talking about the 12 cranial nerves. I know you must have come across it as a medical student, as a nursing student. You must have come across the 12 cranial nerves. You must have seen it on Google. But in this video, I'll be teaching you I'll be teaching you on how to remember it. There are a lot of mnemonics, out there, but I'll be teaching you mine today. Okay, this has helped me while I was in college, after graduation, during my license exam and everything. So why not I share this? So I'm here already to share it. So the cranial nerves are usually assessed is a neurological it's usually assessed during a neurological exam, to find out if there are some maybe dysfunction in any part of the body caused by maybe any damage to the nerves. So let's get right into the video. So of course, these are the 12 cranial nerves. We have about 12 of them, and the first one there is olfactory, optic, oculomotor, trochlear, trigeminal, abducens. We have the facial, vestibulocochlear, glossopharyngeal, the vagus, accessory, and the hypoglossal nerve. So they are usually written in Roman numeral. Okay, you can never see the CN written with the number 1, but it will be written in the number 1 in Roman numeral. Okay, so learn how to write this. In case you are rewriting any theory exams, you don't write CN5, you write CNV. Okay, yes. So get that in your mind. So let's go to how to remember this. This is a lot of them. So the acronym there, or the mnemonic there, is one out of the 12 African female virgins got vaccinated at home. So a quick one. So we see we have the first 3 O's. One out of the TH, the T, the double T, the 12. A, African. The facial, female virgins for vestibulocochlear got vaccinated, glosso and vagus, glossopharyngeal and vagus, at home, accessory and hypoglossal. So you can see that all the alphabets are there and there is nothing in between. Okay, so it's perfectly 12. So you can just try and memorize this, and then you know which one comes first and which one comes last. Okay, so let's go again. One out of the 12 African female virgins got vaccinated at home. You can pause this video, play it as much time as you want. Like during my time, I had to learn this and learn that. I actually have to write it in every piece of paper around me just to remember it. So you are allowed to repeatedly repeat it. So going back to this again, you should know that olfactory is always the first one. Okay, how to remember which one comes first. Olfactory is the first one. So after olfactory is the nose, for the nose, optic for the eye, oculomotor for the eye movement. So the eye comes first before the eye movement. Optic first before the oculomotor. Good. Then for the trigeminal and the trochlear, how I do remember mine is that the last letter comes before the first letter. So the O comes before the tri, I. Okay, it's not alphabetical, right? Rather, it comes from the back. Good. Then for the abducens and the accessory, abducens comes first. I always just bear that in mind. Accessory is one of the last. Okay, abducens comes first. Then we have another 2 letters again, the V, vestibulocochlear and the vagus. So just remember that vestibulocochlear for the ear as well comes first before the vagus. Okay, yes. And then the glossal and the hypoglossal. So the glossal is the first, then the hypo is the last. So just try and remember, and maybe you can actually write this out and paste it somewhere on your room so that you always look at it and remember. So remember, practice makes perfect. So we have 1 out of the 12 African female virgins got vaccinated at home. Okay, yes. We have the olfactory, we have the optic, we have the oculomotor, the trochlear, the trigeminal, the abducens, the facial, the vestibulocochlear, the glossopharyngeal, vagus, accessory, and the hypoglossal. Yay! Good. So how do you know which one comes, which one has are being controlled by sensory or motor nerves? So this is the acronym as well. I just wrote it out here. The olfactory is controlled by the sensory. Anywhere you see S is for sensory, M is for motor nerves, and then B is for both. Both meaning that cranial nerve is controlled by both sensory and motor nerves. So I have two acronyms for you. I'm so generous. So so the two acronyms there, you can actually choose the one you can remember easily. Okay. The first one says, some say marry money, but my brothers say bad business moves market. This is my favorite. Some say marry money, but my brothers say bad business moves market. The second one is, some say marry money, but my brothers say big brains makes money. Some say marry money, but my brothers say big brains makes money. So this one is actually easier to remember. Okay, but I usually use the first one. So some say means that S as the first two cranial nerves, which is the olfactory and the optic, are sensory. Then the third one, which is the oculomotor, is controlled by motor nerve. Then the other one, trochlear, controlled by motor as well. Then B, you can actually write it out and then practice it. So that's the end of the video, and thank you for watching. God bless you. I wish you the best in your nursing career. See you next time. Bye. Kindly share this video, subscribe for more, like. I'm grateful for your support. So